This segment of Delmarva Life is sponsored by Delmarva Dental Services.
Well, it's a place many people avoid at all costs, the dentist's office. It's a space filled with bright lights, sharp tools, and sometimes even fear. But that fear shouldn't keep you from taking care of your smile. With a team of caring doctors to help ease those concerns, that fear can become a thing of the past. I recently paid a visit to Dr. Harmon from Delmarva Dental Services in Salisbury to discover how he's helping patients face their lifelong fear of the dentist, one visit at a time. Dr. Joe Harmon has spent more than 4 decades building trust with patients, many of them terrified to sit in the dentist's chair.
I actually enjoy the people, I enjoy the staff, I enjoy the work. It's very challenging, it's always been challenging. You keep growing, you keep learning.
He says there's one obstacle that stands in nearly everyone's way.
Fear, okay? Well, there's 75% of people are afraid of the dentist. And about 1 in 10 totally avoid the dentist.
Some patients find creative ways to avoid appointments.
I've had people say that it was a sunny day. They were going to the beach. However, the hairdresser trumps all dental appointments and always will trump all dental appointments. The hairdresser, if you have a conflict with the hairdresser, the hairdresser's staying, you're going.
At Delmarva Dental Services, patients fill out an anxiety scale to help tailor their care.
We get a numerical number, and if they score, it's on 0 to 20, okay? But if they score, like say 10 and over, meaning they're not 20, but 10 or above, we ask them specifically what they're afraid of.
For some, a gentle conversation is enough. Others need extra support.
So the first thing is you find out what they don't like, what their fear is, and then you address the fear. And usually what you want to do is you want to address the fear before you do anything. Well, you have to reassure them they're going to be numb, and you're not going to do anything if they're not numb. But you may need to give them some other things, avenues that may make it more comfortable. We could use laughing gas. We could use a tranquilizer like Valium. Or we have oral sedation, which is a sleeping pill. But it has to do with, it's geared upon their score.
In time, even the most fearful patients find themselves walking in without hesitation.
I've had plenty of patients who have been sedated or Valium or nitrous that later on they ease off of it because they gain that trust.
Preventative care goes a long way in avoiding invasive treatment.
Flossing is actually the #1 way to avoid the dentist. And the reason it's important is you have to think of your mouth as it has bad bacteria, it has good bacteria, and it has bad bacteria, okay? And what you're doing is you're basically removing the bad bacteria. If you're not flossing, it's kind of like you're only brushing the top of the tooth.
And when it comes to brushing,
an electric toothbrush is more efficient. It just is. And I've seen it over all these years, and despite what the studies say, but I would say electric always works better. It angles better, it vibrates more, and it's going to take off more plaque, always. And it can be a high price one or a low price one, but it should at least be some kind of brush that's electric.
Dr. Harmon also recommends using over-the-counter mouthwash.
Or you can do a prescription mouthwash, okay, which is chlorhexidine. Chlorhexidine is an antibacterial. So chlorhexidine works well, and we use that especially with people that have trouble cleaning their teeth because it'll reduce it.
For Dr. Harmon, it's not just about fixing teeth. It's about restoring confidence, rebuilding trust, and making fear a thing of the past. He's giving patients the courage to shine inside and out. And Dr. Harmon told me that scheduling your first appointment is easy. Simply fill out the contact form on their website or give their friendly front desk a call. We will have all that information on our website. Just click on What's Happening Today.